The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Hello, my 13-year-old son has been obsessed with toilet for years now. Every place we go with a bathroom, he wants to go use it and take a picture of it. He also draws them at home and sees videos on YouTube of people going to different bathrooms. He gets very happy when he goes to a lot of bathrooms. We want to decrease the amount of time he wants to use the bathroom. When we go out, this causes problems because he will ask, and when we say you already used the bathroom, he will get upset. He will have behaviors like crying, trying to run to the bathroom if one is not holding his hand. He will curse and say, "You better take me to this bathroom or else," and will raise hand and make a fist like he's going to hit us. He will also threaten to leave the house and other multiple things. I do not let him use the bathroom when he has any behaviors, of course. Sometimes we have to remove him from places to the car, which is really hard and emotionally draining. This has been going on for years. We are drained. How do we decrease his need to use all bathroom and see and take picture without all these behaviors? Thanks in advance.
Good. That's a great question, and I'm glad that we're talking a little bit about the subject of actual obsessions, right? Because in psychological terms, an obsession has its own meaning, and I'm not sure it's really what we refer to in ABA or in autism as perseveration. So it's a little bit different, right? So obsessions have a very cognitive meaning in psychology. But anyway, because, so let me explain that a little bit.
Because would this be, what would you classify this?
This could be potentially an obsession because obsessions begin with a mental need or a mental desire to control something. Okay, that's the best way I can put it, I guess. Perseverative behavior is not necessarily always that. It could be sometimes that. Kind of like obsessive compulsive behaviors, right? Where you have this need to feel cleaner. And then you do the compulsion of cleaning. And that's kind of connected, obsessions and compulsions. But perseverative behavior sometimes can be that, can initiate from an obsession, and sometimes it could just be a sensory thing, a pain-related thing, a escape thing. It could be a million other things. It doesn't necessarily have to start with a mental, cognitive, like, urgency. Okay, so that's important, but let's talk about like the whole thing about these, like this one is a great example because this child, for whatever reason, he wants to see, draw, focus on, obsess about toilets. And we don't know, from the email, we don't know the exact, what aspect of it, right? It could be, what is this thing and where do things go? That are put in there, which many children are like first scared of toilets because like you put something in it and it disappears. And kids
it's a magic trick.
And kids often wonder if they're going to fall in there and be gone. You know, like it's a scary thing for them. The other aspect of it could be like some children are disturbed by other children are fascinated by the sound of the flush. Other kids could be visually stimulated in the look of water when it flushes.
Jem had an issue in bathrooms, like he would just disintegrate in bathrooms. It took us years to understand that it was the echo.
I was just about to say that one, exactly, because bathrooms are not carpeted, so there's always going to be a more hollow sound in bathrooms, and so that could be one as a sensory input issue. So we don't know which one it is for this child, right? It could even be like seeing other people in there or seeing people wash their hands. I don't know. Like, we don't know the detail of it. But clearly, if we want to fall back on just the rules of behavior analysis, the rule is if something is classified as a challenging behavior, if you see it as something that's challenging, which clearly is becoming challenging to the family, right? It's making it difficult for the family. you must replace it in a way, like with some other thing that's more adaptive functional, and you must not allow it to occur or to gain, its results. So in other words, what would happen if you don't allow your child, did they say the age?
I don't think she did say.
But it's like
13.
13. So this is the bigger issue here for me.
Yeah.
And we'll go back to the obsession in a minute. But the bigger issue here for me is that the child is actually controlling the scenario.
Yeah.
Because parents are already afraid of what would happen if they don't let the child go to the public bathrooms or any bathroom or whatever. And parent is actually stating that the child will do a bunch of very inappropriate things, including, having a major meltdown about it, but also having gestures that are threatening. And that's not okay. Like, we got to start there. That is much more important. Yeah. Because imagine if your child did that to someone else in school, another child, a teacher, whatever. It's just not okay. Or even to you, as they're getting older, your child you do not want the child for any reason at all to aggress. No circumstance makes that okay. Yeah. So it doesn't matter how much of an obsession or need the child has, it just doesn't make it okay, society-wise. So you must, I would suggest that you get support if you're going out, and particularly don't do this in day-to-day living. Like, this is, again, one of those scenarios where we often just let things happen and we think we're going to deal with them when they happen. No. Do this as a practiced exercise. Pick every hour, like let's say 5 o'clock every day, we're going to do this for this week, because if you do it for a week, it'll be over. Okay. Every day, get support, so get other people with you who are strong to help, because 13 is already difficult. And just plan this, head into it. Go to a location where your child is definitely going to ask to go to a bathroom. Like, put the thing in place, right? Practice it, evoke the scenario. So go out there, and as soon as your child says, I want to go to this bathroom, say no. And you said it once and say it clear and loud, and get all of your support around, because your child's going to go into all of those assertive, aggressive stances, and you're going to help the child and support the child to actually, while they're tantruming, being challenging, whatever, with the help of your friends or support, you're going to go into the car and you're going to go back home. And that's what's going to happen. And you're going to do that every day for 5, 6, 7 days, and your child will stop requesting for that particular bathroom. And you're going to have to do it with areas that are very high MO, like the child generally tends to ask for that particular bathroom. Now, at the same time, so in other words, you're going to block that response from occurring. Now, and please be aware that it could get worse before it gets better. That's the extinction burst. But at the same time, you may really want to discover what it is about the bathroom that is so fascinating for your child. We choose things. So becoming aggressive when not allowed to go to public bathrooms is something you're not allowing. But perhaps you can allow the child to draw bathrooms at home. That's less invasive to anyone.
Yeah, maybe he's a bathroom designer.
Maybe he's a bathroom designer. That's a really good way to put it. Or maybe that if you can determine what aspect of the bathroom is so fascinating or obsessive to him, we can come up with some other alternative way to satisfy that need. So if it's, for instance, I don't know, if he's very just curious about where things go, then hey, take him to Home Depot and show him that there's a hole at the bottom of it and there's a sewage system and educate him on it.
Make him take a tiling class.
Exactly.
At Home Depot, they do it for free on Saturday mornings.
Yeah, figure out what it is that he's all into. If it's about the sound, there's lots of other opportunities where he can get the sound. If there's other, so investigate what it is that is the antecedent to this. Why is he fascinated? So that we can help meet his need in a different way.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.